Yeah, but I did actually do 4 years on the Bayside District Health Council for a period from about 1998 to 2002. Somehow I got elected onto that when the Albridge government came up. Not that I voted then, but when the Labour government got in, it seemed to like me. I don't know why. Anyway, in that period it was interesting to see how the public health system worked. At the time I was working in the private health system, and one key thing I learned was you cannot separate health from politics. I actually did a master's degree in health policy and management, and that was in the first chapter, and I think the thread came all the way through my studies. Unfortunately, there's never enough money for health, and health was regarded as being something that, certainly in the 80s and 90s, where you treated the symptoms. We've moved away from prevention. We've now gone 180 degrees, hopefully in the other direction, and now, and certainly the Greens policy is one of prevention. Because if you can make people healthier, you then save the health system an awful lot of money. Now we know that smoking is one issue, but dental services is a key one. Dental services, the brotherhood of St Lawrence did a study and showed that by not having dental care as part of Medicare, it was costing the health system $2 billion a year. So we'd be better off putting $500 million into dental care. The Greens have managed to secure that as part of the negotiations with the federal government. And it's the Greens that have pushed. To me, it's a total disparity that dental care is not part of Medicare. Certainly, can you imagine having to wait months, sometimes years, for dental care with an aching tooth or other similar problem, not being able to eat properly? And that happens.
David, could you just concentrate on the SMBI side of the issue?
Yeah, well, you cover dental services, and I'm talking about prevention. How will I support this? I support any facility that is demanded to help people who need medical help. I think we live in a compassionate society, and I certainly welcome the development of the health hub. But what I'm saying, health just chews up so much money that we've got to look at another way of trying to make a healthy society. We're seeing this problem with obesity. There's a whole issue here with education, how much is isolated health, education and recreation, and a whole raft of other issues that actually impinge on health. And certainly, as I said, my experience with the public health system in the Bayside, I saw the needs that in what is a very wealthy society. Let's not say that we're like a lot of other places in the world. Australia's got one of the best health systems in the world, but it can do better, and the money should not necessarily be put into major big hospitals which are handling sick people, but actually put into the community, so we can actually prevent people getting sicker by having them dealt with in their local community. And I'm certainly 100% behind the development of the health hub. Thank you.